Nurses under the aegis of the National Association of Nigeria Nurses and Midwives, Abuja and Lagos chapters have protested the new circular on certificate verification by the Nursing and Midwifery Council of Nigeria. The nurses converged on the association's offices in Abuja and Lagos to express their dissatisfaction, threatening a nationwide strike and describing the new guidelines as an effort to impede their freedom. Josiah Jackson-Okesola is a UK licensed and practicing professional mental health nurse clinician. He joins us now to give more insight on this development. Josiah, it's good to have you with us. So, can you reflect on the narratives regarding new guidelines for nursing in Nigeria, and how proactive is this development, you think?
Yeah, thank you very much for having me. Policy, there has been a lot of uproar regarding this policy. It has been dissected over and over again. The contents have been analyzed, and majority of nurses are insisting that it is anti-people, it is anti-progressive. But let me start by saying, with the new NMC policy, the federal government is right, and the Nursing and Midwifery Council is right. And why did I say this? The federal government expressed its concern that there is a brain drain of nurses, which is affecting the healthcare system, leaving the hospitals empty. There's no lie about this. This is facts. We all know. The federal government is also saying that they're concerned about the image of the country because there are reports that a few Nigerian nurses are involved in malpractices abroad, and they want to launder the image of the country, so they need to curtail the rate at which nurses migrate to other countries. Incidences happen. This is not the first time Nigeria is going to have report cases of people involved in malpractices. So this report is actually true. Now, the NMCN, the Nursing and Midwifery Council, says that the rate at which Nigerian nurses are leaving without due process is of concern. And the responsibility of the Nursing and Midwifery Council is to protect the interests of the public and to regulate the nursing profession. So expressing concern over this development is also right. So if you look at it, the federal government is expressing concerns. The Nursing and Midwifery Council is trying to fulfill its obligation of having oversight over the nursing profession in Nigeria. So it is right. That's not a problem. That is not the issue. Making policies, expressing concerns and putting measures in place is not actually a problem. It is a step in the right direction. So kudos to the Nursing and Midwifery Council for waking up to its responsibility. It's always, in the last few years, it's always done, it's done marvelously well in regulating the nursing profession. Now, there is a problem. There's a big, huge problem. Presently, with this new policy, Nigeria is sitting on a keg of gunpowder, sincerely speaking. Nigeria nursing is like a time bomb waiting to explode. Why did I say that? Having said that the FG and the Nursing Council is right, I will use an illustration of the medical field so that we can understand. Now, someone is having a migraine. The doctor comes in without even taking any history, without asking any question, without doing any tests. The doctor prescribes a medication for a condition that has not been diagnosed. The root cause analysis has not been done. Now, not only that, the doctor feels that, oh, the medication I give is supposed to work. It's not working. I'm increasing the dosage of your paracetamol from 2 tablets to 4 tablets. That is terrible practice. And that's what's happening presently in the nursing profession. That's what's happening in the healthcare system. Now, this measure, this NMCN policy that has been put in place, are just treating symptoms. There are critical issues that have developed over the last 2 decades that have not been addressed up to this moment, and these issues are degenerated to the extent that it is now a keg of gunpowder about to explode. And the next thing the National Midwifery Council is doing, the federal government is doing, is treating symptoms and ignoring the root cause analysis. What actually led, what brought us here to the first place? I must tell you, sincerely speaking, every single Nigerian do not wish to leave the country. Let me make this clear to you. Now, the federal government has never been in the shoes of Nigerian nurses, ever. The Nursing and Midwifery Council leadership has never been in the shoes of Nigerian nurses. So, if anyone should be able to tell you how it feels to practice nursing in Nigeria, it should be people who have passed through the system, people like us, who have spent 20 years in the public and private healthcare system in Nigeria before moving to United Kingdom, Canada, Australia. In fact, some of my colleagues left Nigeria, moved to UK, left UK, moved to Canada, left Canada, moved to US. Some of them moved to Australia. So we have a bulk, thousands of Nigerian nurses who have over the years passed through the Nigerian nursing system, healthcare system, migrated outside the country, passed through different healthcare systems in different developed countries, and they have had a large chunk of experiences, large chunk of expertise, skills, intellectual ability to be able to tell you this was the problem. This was why I moved. If these things were there, I wouldn't move. I tell you, it took me almost 10 years to make up my mind I was leaving because I was bent. Personally, I was bent on what can we do to help prevent the situation that we are now. Many of us invested energy, time, effort in trying to prevent the situation. The National Association of Nigerian Nurses and Midwives, the leadership of Nigerian nurses, have been talking for almost 20 years. I've been making a lot of noise for almost 20 years, but this noise has been ignored. Now, let me tell you why I say we're sitting on a keg of gunpowder. These measures are not the problem. The problem is that there's an adage that says when a mosquito perches on the scrotum, you don't use a sledgehammer to kill the mosquito. You're going to cause total havoc. And that is what is going to happen. That's what is about to happen. Chaos, havoc. Because this measure is like taking a sledgehammer and trying to kill a mosquito that perches on the scrotum. These measures is like what we call, there's something in nursing we call, when we want to administer medication, we call it 5 rights of medication. You administer to the right patients, the right dose, at the right time, in the right measure, to the right route. Now, the Nursing and Midwifery Council is trying to administer a medicine for an ill health that they have discovered. They are giving an overdose of the medicine to the right patients, which is the nursing profession, the nurses itself. Now, they are giving it through a completely wrong route. They are also giving the wrong dosage, the wrong measurement. And it means that presently, the nursing profession between 2020 and 2024 have been pushed to the extreme, has been dragged to its limits, has been thinned out. Before 2020, the nursing profession has suffered for 20 years in that they have worked in the most inhumane conditions that you can ever imagine. I tell you, you can't imagine the conditions, the environment that nurses have been managing, have been enduring, have been practicing for 20 years. I was in the system for 20 years, and I'm a witness to this. I entered nursing profession in 1997. I graduated in 2000.
Okesola, I'd like to come in here because you were talking about solutions at this point. And if we look at these guidelines that are stipulating these several requirements for certificate verification, including a minimum 2 years of post-qualification experience, a letter of good standing from both the applicant's place of work and the last nursing training institution, nurses are arguing that these new guidelines are, of course, hindering their freedom and exacerbating the existing challenges such as unemployment and the poor welfare. However, the registrar of NMC and Dr. Farouk Abubakar has assured these protesting nurses that their complaints would be addressed promptly. Now, from your perspective, what actions should the NMCN take to address these grievances raised by nurses and ensure that it's a fair and transparent verification process? How do we get rid of this fly so that we don't hurt the scrotum?
Number one, this NMC policy needs to be withdrawn first. That's the first step. Why should it be withdrawn? This policy was decided without taking into consideration two major things. One, what is the global best practice? What is the stage? What is the state of nursing globally? There's something they call the Triple Impact Report, released in 2016. The Triple Impact Report is a report that was generated after a lot of deliberations were made by global health experts trying to understand why we are struggling with achieving sustainable development goals, why we are struggling with achieving universal health coverage, and what did the recommendation come out of? What was the recommendation that came out of the Triple Impact Report? It was that as long as you continue to say to push for the sustainable development goals and universal health coverage, but you are not building these policies around the welfare of nurses, you are not building these policies on the investment of nurses, it is going to fail. So why I say this policy needs to be withdrawn is because this policy was not even built around the investment or welfare of nurses. One, there are bodies of nursing in the diaspora. We have the Association of Nigerian Nurses in America. We have the National Association of Nigerian Nurses in the United Kingdom. We have that of Ireland. These are the people that are supposed to be invited to sit with the Nursing and Midwifery Council and the federal government, with the National Association of Nigerian Nurses and Midwives, to decide. We have a situation on our hand. This is what we are thinking of doing. What do you think? That is the first step that was supposed to be taken. Involving the stakeholders who have passed through these pains, who have passed through the system, who are doing extremely well in their respective countries outside Nigeria, involving them in a discussion, brainstorming. These people are very intelligent. They have solutions to this problem. Involve them in the first place. That's number one. Number two, the federal government has ignored what WHO has said in the last 5 years. International Council of Nurses, WHO, is a voice of healthcare all over the world. Now, this is what WHO said. Dr. Tedros, in the last 5 years, has insisted that any country that is developing a policy that is not looking at investing in nurses, that policy will fail. It is online. It is there. The federal government is not taking it into consideration. The Nursing Council is not taking this into consideration. These are policies that should be used to develop this policy. So we need to withdraw that NMCN policy first, and now use these resources to develop a policy that will take into consideration the positive solution, progressive solution to the matter on ground. Number two. Second thing that should be done is face reality of.
All right. On that note, unfortunately, we that's as much as we can take. Josiah Jackson-Okesola, founder, CEO, Nurses on Air, would like to thank you very much for your perspective on that topic. It's good to have you with us.